Testing, testing. Good morning, everyone. Can you all hear me okay? Awesome. Thank you so much for joining us today for our third Health Equity Lecture. I want to first thank my colleague, Dr. Jennifer Swanberg, as she and I have kind of put together this whole health equity program and set up the lecture series. And we're very happy to be able to continue this work through the support of the College of Health and Wellness and the Provost's office. So thank you so much for your continued support. So we have an excellent speaker with us today. I feel very privileged to have her here with us. Sonali Rajan is an associate professor of health education in the Department of Health and Behavior Studies at the Teachers College at Columbia University. So she came to us today from New York City. She also has a secondary faculty appointment in the Department of Epidemiology at Columbia's Mailman School of Public Health. Dr. Rajan is a school violence prevention researcher studying gun violence prevention, school safety, and adverse childhood experiences. Among her various projects, she's co-leading research on school violence funded by the National Institute of Health, as well as the Centers for Disease Control and Prevention. Dr. Rajan also co-produces a podcast, Research for Solutions, which is hosted by Media and Social Change Lab at the Teachers College, and it's devoted to amplifying creative and evidence-based solutions to the persistence of gun violence. Dr. Rajan's work prioritizes the need for schools and communities to collectively attend to the well-being of children while keeping them safe, reducing their exposure to violence, and ensuring opportunities for them to thrive. So I hope you all will join me in welcoming Dr. Sonali Rajan today.
Good morning. Can you guys hear me if I keep my mask on? Is that okay? Okay. I have a 7-year-old, and he's cute but a little germy, so just in case, that's what we'll do today. Thank you so much, Dr. Rosenthal, for the invitation to be here. I took a very early train this morning, but I've had 4 cups of coffee, so I'm ready for you guys. Thank you for the introduction. I do like to sort of give a little bit of context for my work. I'm not solely in the School of Public Health or solely in the School of Education. My work really does sit at the intersection of health and learning, and I think that's an important framework for understanding how I approach my research and the translational and practice work that I do, which is to say that I'm really interested in how we can best support kids in schools, meaning their health and well-being impacts their ability to learn and to take tests and to do all the things we expect of kids. And so that connection sort of surprisingly doesn't get talked about enough. Even though it's a pretty obvious one. So I spend a lot of my time talking through those connections and why they matter and why we should be thinking about children and their school environment in a more holistic way. So I am, when people ask my husband, what does Sonali study? And he says, well, think of like the saddest things possible. And so that's what we're going to talk about today. However, I am going to try and divide my talk up into sort of 2 chunks. The first chunk, I do want to talk about adverse childhood experiences and gun violence in particular, and I am, as I often am, devastated to be talking to you today on the heels of yet another school shooting that we saw just yesterday in St. Louis. But I do want to spend the second half of my talk being a little more optimistic and sharing with you what I think is a path forward for how we can solve and address this issue. So that's what I'm going to now even wear my watch, so I'll keep us on track. And think of questions, because I'll take all the questions afterwards. Okay, so just to orient ourselves a little bit, as Dr. Rosenthal mentioned, I study adverse childhood experiences. And essentially what the short term for this are ACEs. And ACEs are essentially what we consider stressful or traumatic events that impact the healthy development of children all the way through adolescence and into adulthood. And ACEs, they persist as a public health challenge in the US. They're very prevalent. I'm going to give you examples of what an ACE is shortly. But about 2/3 of adults report having experienced at least one ACE. Now, an ACE is historically been focused on issues of like child maltreatment, household dysfunction, essentially traumatic events that can happen during childhood. And we've really, the concept of an ACE has been around for about 20 or so plus years, even though it's happened for long after that. But more recently, a lot of research, and mine included, has really advocated for other types of experiences that happen during childhood, experiences with the juvenile justice system, gun violence, among others, to also be considered ACEs. And so it's tragic in that ACEs are so prevalent and that there are such a wide range of ACEs that even occur and that so many children do experience them, and that many children experience multiple ACEs. So it's a complicated public health challenge, but one that we can do a lot to both prevent but also intervene on, and I'll talk about that in just a little moment. Now, oh, you can see this. Okay, great. I couldn't see my screen, so I was like, there. All right, there we go. All right. So as I was saying, ACEs in and of themselves comprise all these different types of experiences. And perhaps unsurprisingly, and as we see with many public health issues, there are also stark racial inequities that occur in the context of ACEs. So right now, there are data from Child Trends, which have estimated that about 45% of all kids in the US have experienced at least one ACE. And across the nation, 1 in 10 children has experienced 3 or more ACEs. And nationally, the burden of ACEs disproportionately does fall on Black and Hispanic children in comparison to their white peers. So our goal in this collective space is not just to reduce ACEs from happening in the first place, but certainly to also decrease the very clear inequities that occur in this context. Okay. Now, you might say, why are we spending so much time talking about ACEs? And I'm going to kind of toggle between this slide and the next slide to explain why ACEs are so important. So first, there's a whole body of research, and like I said, this is a term that's been around since the late 90s, but just an enormous body of research that has established the connection between ACEs and short and long-term health and learning outcomes and developmental outcomes and economic outcomes among kids and into adulthood. And so I'll share a little bit of a funny story. A few years ago, I was writing a systematic review with some of my colleagues, including one of my wonderful doctoral students. And my student, so a systematic review means we basically said, okay, we're going to look at every single paper that talks about a given topic and review it, and then try to make sense of all the things we are reading. And my student who was working on this paper with us said to me, she's going through and she's like, did you know that ACEs are connected to every possible negative health outcome you could ever imagine? She would email me, your poor oral health or cancer or substance use or increased poor mental health. Think of any poor negative health outcome, short or long term, ADHD, you got really anything, and it can be tied or connected back to an unmitigated ACE of some kind. Now, what do I mean by unmitigated? Okay. So this pyramid is from the Centers for Disease Control and Prevention, the CDC, and it essentially describes the pathway of what happens when we experience an ACE, and then what happens if we don't intervene on that ACE. So you're probably like, I thought she was going to talk to us about gun violence, and I promise you I'm getting there. But this, to me, feels important, so I just wanted to give us this context. So if you look at the bottom of the pyramid, okay, that's the ACE, right? So all these examples I was talking about, having parents who are incarcerated, experiencing child maltreatment, exposure to gun violence, interactions with the juvenile justice system, all of these things, parents divorcing, all of these things are ACEs. And so they occur, and we should be doing our best collectively to reduce them from happening in the first place, but they do tragically occur. Okay. If an ACE then occurs, right, and this is something, like I said, we use the term traumatic, and so it is it's really something that changes and can shape our brain, right? It really changes how we, as a child, experience something. That can lead to what we call disrupted neurodevelopment. And if we don't provide grief therapy, family counseling, meaningful interventions and support in schools, out of schools, like if we don't, and by we I mean society, right? Policies, programs, making all of this accessible to children, because this is the very, very least we could do to support kids. If we don't provide that kind of support, then ACEs lead to this disrupted neurodevelopment, which in turn can lead to social or emotional or a cognitive impairment, which then make it more likely for kids and adolescents who are already probably more likely to make maybe not the best decisions in any given situation. It makes them way more likely to adopt what we would call high-risk behaviors, and you can name many. And that can then lead to disease or disability, more than they would have experienced otherwise. And again, that can lead to a shortened lifespan or an early death. So the reason I care so much about ACEs as a concept, and the reason it's really important to think about preventing and then also intervening on them, is because this is what happens when we don't give kids the support that they need and they deserve. And the research has shown in this space that the more ACEs you experience, and remember, kids can experience multiple ACEs, then the more likely you are to move your way up this pyramid, okay? And the research also shows that if you are a child of color in this country, you are more likely to experience an ACE. You are also more likely to experience multiple ACEs. And that is a systemic failure, right? That is not a failure of a given family or a given child or even a given school. That is a systemic failure of policy and of how we think about supporting kids. So that's a lot of where I sort of live in terms of thinking about, well, what do we do about this? I told you we would get here. Okay, so a few years ago, I was mentioning this paper. You can see the citation for this is on the bottom. So in 2019, I'm working on this paper with my colleagues and my wonderful student, and we reviewed 81 different journal articles. I remember doing this over Thanksgiving, and my family was like, okay, come watch a movie with us. I was like, we can't, we're reading about ACEs. And we wrote this paper to essentially make the case that exposure to gun violence during childhood should be explicitly captured as an ACE, because when we screen for ACEs and then when we try to connect kids to resources in the context of ACEs, gun violence is not explicitly included in that. Now, there's a lot of reasons why that probably is, lots of politicized reasons. Some of you may know that for almost 2.5 decades, there was no federal funding devoted to the science and study of gun violence. So as an issue, it's a very politicized issue. We all know this. But at the very least, my colleagues and I said, well, but the prevention of gun violence during childhood, it isn't a political issue. It's a child health issue, right? It's a learning issue. It's a school health issue. So we used this paper to really make a case for that. What we showed, bless you, what we showed in this paper was that it's not just enough to capture whether or not a child is shot or killed with a gun. I'm going to talk about this more in just a moment. But that children experience a wide range of exposures to gun violence. They hear gunshots. They witness gunfire as they walk to and from school. They have a friend or a family member or a loved one who was killed with a gunshot. All of these are experiences that are potentially traumatic, that meet our criteria for an adverse childhood experience, that ought to be intervened on, right? Let's go back to that ought to be intervened on after they occur. But if we're not even measuring this or capturing this, how do we then connect kids who have had these experiences to the support and the resources they deserve? And it's not just them, right? Maybe it's their parents, it's their neighbors, it's their community at large. Now, gun violence, some might argue, okay, maybe this isn't, how often could this possibly be happening, you might ask. Well, turns out it's happening all the time. So I'm going to give us a few numbers to work with here. So gun violence, just as a broader public health issue, is just extraordinarily devastating. I think sometimes if I I think about this issue all day, every day, and it takes my breath away every single time I think about the scope of this problem. So over 100,000 people in the United States are shot with a gun every single year. 100,000. And over 45,000 as of the most recent, as of 2021, and that number has gone up, but over 45,000 of those individuals die from their firearm-related injuries. And that's just the tip of the iceberg, right? That does not capture the kids who survived school shootings, the kids who witness gunfire, the kids who hear gunshots on their way to and from school. It also doesn't capture the fact that for some kids, gun violence is not just a one-off thing. We think about it as, oh, you survived this one shooting. There are many children in this country who are exposed to gun violence in different forms repeatedly. So when we start to bring all of those pieces together, it is a crisis of a scale that warrants real, meaningful investment in terms of prevention and real resources to say, we can do better on this, and real bold leadership on a policy front to say, why aren't we doing more to reduce this from happening in the first place? Now, 2021, and I'm going to talk about this as we move this in the context of COVID, 2021 to date is the deadliest year on record for gun violence. 2022 is shaping up to be even deadlier. We have 2 more months to go, so let's see. And gun violence, as of now, is the leading cause of death among children in the United States. The leading cause. It wasn't always, but it has, over the past couple of years, become that, which is, again, just so extraordinary when you think of we are a nation that is so well-resourced and with so much opportunity, and yet here we are, okay? Now, part of the challenge right now is that we are not just dealing with gun violence, right? We are not dealing with just ordinary ACEs. We are also dealing with all of this in the context of a global pandemic. Now, COVID, as we could all expect, has exacerbated many ACEs. As of the last, I double-checked this earlier this week, but well over 250,000 children have lost at least one caregiver to COVID. Okay, that's an example of an ACE. ACEs in the context of abuse or neglect or household dysfunction all increased during COVID. Gun violence, as I was saying, has increased considerably during COVID as well. A big reason for that, I get asked this a lot, but a big reason for that is that there's been a huge increase in uptick in the proliferation of firearms. So there's a great graph, I should have found it so I could show you, but maybe I can send it around after. Back in April of 2020, the New York Times published this really stark figure showing this huge uptick in gun sales that coincided with the onset of the COVID-19 pandemic in the United States. So right now in the US, there are more than 400 million firearms in circulation. That's more firearms than there are people, like if we're trying to understand how many that is. It's a lot, okay? Now, some of the research that my colleagues and I have done and others have done have shown that if you live in a state with more restrictive gun laws, okay, that those restrictive gun laws, when you piece them together, do help. And I'm going to talk about policy in a little bit. But there are many states in the US that have what we call permissive gun laws, meaning it's easy to obtain a firearm, it's also easy to carry a loaded firearm in different spaces and in different ways. And that is directly related to increases in all different types of gun violence, in schools, in communities, etc. So we're living in this global pandemic. We have this uptick in gun violence, this increase in ACEs, and some of the work we just did earlier this year has shown, though, those disparities I was talking about earlier, well, those have all just gotten so much, if we thought it was bad pre-COVID, it has just gotten worse. I told you, this is my students always are like, Dr. Rajan is like going to say some doom and gloom data, but this is the reality. This is where we are at with this. So Some of the work that my colleagues and I did earlier this year, this is work that was led by some of my colleagues at Boston University, looked explicitly at racial disparities in childhood exposure to gun violence. And we looked at data before and then after the onset of COVID here in the US. So what we did here is we looked at data from, it comes from a website called Gun Violence Archive, which is really a remarkable resource in that they really document every instance of gunfire pretty in real time. I mean, it's kept remarkably up to date, and we were able to look at quite a bit of data that we got from them. And we also looked at data from the US Census, and we looked at kids, okay, ages 5 to 17 between 2015 and 2021, okay? So we really got to capture what was going on before COVID, what was going on after COVID. So just to give you an initial thing, the year before COVID happened, about 9 million children ages 5 to 17 were exposed to at least one firearm fatality in their neighborhoods. That number went up to 11.2 million in the year right after COVID, okay? That's to quote my 7-year-old, that is a bananas amount of children. 11 million kids, that is a lot of children, a lot of kids. A lot of kids who have been exposed to at least one firearm fatality. I'm not even saying, like, that's the bare minimum. What's even more devastating when you look at these numbers, I mean, we had to give you some context, we had to double check these numbers to make sure we were like, is this correct? Did we do something wrong in our analysis? I mean, this is the scope. When I say the magnitude of this problem is so vast, this is what I mean. Our work then found that Black children in particular carry this burden in such a disproportionate way. They are 4.4 times more likely than their white counterparts to experience neighborhood firearm violence. 4.4 times more likely. That's a huge increase in likelihood. Simply, again, a result of systemic failure, right? And we also found, and I thought this was interesting, that the disproportionate exposure to gun violence also impacts Native American, Asian Pacific Islander, Hispanic, and multiracial children far more than their white counterparts. Not as much as Black children are experiencing, but certainly far more. These disparities, which existed before COVID, have only increased since the onset of the COVID-19 pandemic. Now, this isn't surprising in some ways. I think COVID laid bare our vulnerabilities, right? It laid bare all of the gaps in our resources, in where we prioritize care and well-being, and how we think about addressing and putting together solutions to these kinds of problems. Now, I mentioned, I really am interested in what happens in schools, and the bad news is these issues, what we're seeing in our communities, same thing is happening in our schools in slightly different ways, and warranting maybe slightly different ways of thinking about a solution, but the schools piece is equally concerning. So if we look during the same period, since 2015, just under 300 or so, we've estimated there are about 300 or so intentional shootings in K-12 schools. My colleagues and I are doing quite a bit of work, I'm going to talk about this in a little bit, but looking at intentional shootings in K-12 schools. You might say, what do you mean by an intentional shooting? Well, I'm talking about someone going into a K-12 school with the intent to harm someone else. If you actually look at the existing K-12 shooting data, you would be amazed is not the right word, maybe disturbed, to know that there's a number of accidental shootings that happen, unintentional shootings that happen in schools. Guns that go off because people are carrying them loaded. It turns out a school can be a chaotic place, and maybe carrying a loaded firearm is not the best way to go about it. So we do see other types of firearm violence in schools, but my work really looks at intentional school violence. So we see school shootings like this increasing. At the same time, we see we've seen gun violence in our neighborhoods increasing. We see racial disparities also increasing. So we tend to see in the news, I actually think yesterday's shooting is a really interesting example, where it's a shooting in a school that serves predominantly black and brown children. And that shooting did not make the national news the way we often see other shootings do. Now, I'm not interested in playing the comparison game, which tragedy is worse than others, but I think all types of violence perpetrated against children should be brought to our collective attention so we do something about it, right? So we see all of that happening. We also know, and I kind of go back to this idea of an ACE and what gun violence exposure in childhood is. Well, it's not just, right, about getting shot or killed. It's also about, were you even exposed to gun violence at school? There's a wonderful team of reporters at the Washington Post led by John Cox, and they run a database where they quantify the number of children who have been, they have been quantifying the number of children who have been exposed to gun violence just at school, so not in anywhere else, but just at school, since the 1999 Columbine shooting in Littleton, Colorado. Now, every time I go to that webpage, and I did just this week as I was putting these slides together, that number goes up. That number right now is at 320,000. So since 1999, which is when I was in high school, so you can think it's a long time ago, but since 1999, over 320,000 children have been exposed to gun violence just at school, okay? Again, that number just continues to increase. So it's a huge number of children. Add that to the 11 million kids just last year who've been exposed to gun violence in their neighborhoods alone, right? So the scope of the problem is really vast. And some of the work we've done has talked a lot about the indirect implications of the implications of this indirect exposure. We call this indirect exposure to gun violence. The idea that, yeah, okay, maybe you weren't shot or killed directly, but all of these other experiences, especially for children, as they are growing and developing and changing physically, emotionally, socially, these experiences have profound effects. And I can tell you right now that before COVID, it was already difficult for the communities that need it most to get access to many of the services I was describing before. And it is just as hard, if not harder now to do so, right? To have equitable access to mental health care, to, like I said, grief counseling, to family supports, to all the things we need, even professional development for a teacher that really attends to what we call trauma-informed schools. To do that pre-COVID was difficult, and now it's even harder. So, like I said, I could spend, this is the scope of the problem. And one might argue that if you saw all this and thought about it every day in, day out, you might just go lie down and take a nap because, well, what are we going to do about it? But the one thing that I think gives me and my colleagues just an extraordinary amount of optimism, and I hesitate to use that word, but I do really believe in this very firmly, is that we do have solutions that we know work. And there's a lot of things that we know work, and if we put them together, we could actually think through what I would say is an evidence-informed pathway forward. So this is me talking not as a mom, but as a scientist, and as someone who's really trying to very objectively look at the existing data to try and make sense of, okay, this is what works and this is what doesn't, and how do we make sense of this? How do we help schools and communities make sense of this? Because the one unifying thing I think we can all agree on, no matter how politicizing gun violence is as an issue, is that something should be done, okay? I'll tell you, back in, after the Uvalde shooting, I was talking to a reporter who wanted to know, I'm forgetting the state, I think it was in Ohio, and I think Ohio, shortly after that shooting, maybe their governor said that they were coming out with a policy that not only could teachers be armed with a firearm, and about 28 states right now do allow teachers or school staff to carry firearms in school, even though there's no evidence that that works. But not only could teachers carry a firearm in school, but that they would only need a 24-hour training, as opposed to whatever maybe it was a 2-week-long training before that. And so the reporter wanted to know, what did I think about this proposed idea, which, of course, it doesn't sound like the best idea, right, to say, well, I'm going to take an educator and I'm going to arm them with a weapon and only train them for a day and hope that that sticks, right? That doesn't seem prudent or like it would be effective. But I did say to the reporter, and I think it's important to underscore as we think about collectively how we approach this problem is, I said, I empathize with the governor's sense of urgency because he is correct in that we need to do something. What we disagree on is the approach, but I agree that we need to do something. He's like, well, we need a teacher in there in 24 hours armed and ready to go. That urgency to do something, that is something that I think is really important. And I think we all can agree that there's an urgency to do this, that the scope of this problem is too vast and too devastating to step back and say, let's take several years to figure this out. And frankly, our kids collectively deserve more. You know, I'm biased. I do, like I said, I have a 7-year-old. But it's not just him. It's the 51 million kids, right, who are served by our public schools in this country. So with that in mind, we just wrote a paper that just came out, and so the next few slides reference this. It just came out in Preventive Medicine. Preventive Medicine is a journal where they look at different types of public health issues, and what was really interesting, and I think much of this is available open access, at least for a couple months, so it might be worth checking out, but they devoted an entire issue to the study and science of gun violence. So this whole journal issue that our piece is in is one of several papers that are focused on gun violence and how to prevent it in different forms. So my colleagues and I, and this is a team that I work with, and they're just fabulous, said, well, how do we think about, if we bring the various things we've been talking about, what could a meaningful pathway forward look like? And so I do want to take the next 10 minutes and just walk us through what I hope for you is a little bit of optimism on this issue. So the first is we need to change how we think about this issue in the context of reaction versus prevention. So right now, the way we think about, and I'm going to focus just on this on the school context because it's most relevant to my work, but you'll see in a moment that it ties in quite a bit of the role of the community as well. So right now in a typical public school, and maybe some of you experienced this when you were in high school, but most gun violence prevention safety strategies in school are in place to respond to violence in the moment of that violent act, okay? So you might you might see active shooter drills, you might have locks on your classroom doors. I was mentioning that over half the states right now in the US allow school staff to carry firearms, so you might have an armed teacher or an armed school resource officer. Metal detectors, bulletproof backpacks, right? We see all sorts of things right now that are in place in schools with the intent of hopefully reducing the lethality potentially of a shooting and or to deter an intruder if this were to occur. But what we are arguing is that we need to be way more strategic. And we actually need to address gun violence in schools well before it's a threat at your classroom door, which is actually how we think about most other types of prevention, right? The prevention of obesity or type 2 diabetes, or we think about, car safety and road safety, right? We're not assuming that all of these things will happen. We're saying, what can we do to reduce the likelihood of it happening in the first place? So we wanted to apply that same framework here. We also wanted to recognize that kids are humans, right? They're people, that we cannot have potentially traumatic safety strategies in place if those are going to cause unintended harms. My 7-year-old just did an active shooter drill, right? He's done 6 now at the age of 7. And there's some really, and I'm going to talk about this in a little bit, there is some work that shows that done in a certain way, lockdown drills in particular could be effective, but that can't be the thing that we rely on. Okay, so what does the solution look like and how do we move forward? So we said to ourselves, let's reimagine the prevention of school gun violence really as an opportunity to invest more meaningfully and thoughtfully in schools and in its surrounding communities, and by extension its kids, but also teachers and school staff and everyone who's a part of that community would ultimately benefit. So we basically broke this down into 3 parts: primary prevention, secondary prevention, and tertiary prevention. Have you guys heard of those terms in your class? Yeah, okay, great. Yay, I figured, all right. So in public health, good public health prevention calls for a focus on primary prevention efforts. So the idea here is saying, before there is an active school shooting, before there's even a credible threat, what is happening, right, in our communities, in our schools, and at the policy level, to say, how do we make it really hard for an intentional school shooting incident to even occur? The fact that I mentioned a number earlier, just under 300 intentional school shootings in the past 5 years, that's ridiculous, right? That is a ridiculous number of active school shootings, and we can actively prevent that. So we broke it down and we said, all right, let's look at the community, let's look at the school, and let's look at policy. Now, what we did here is, again, I used that term earlier, a systematic review, okay? So we did the same thing here. My wonderful students and our team came together, looked at all of the existing research to say, all right, what do we know actually reduces, what do we know actually reduces the prevalence of gun violence, and by extension would also improve the health and safety and well-being of communities and kids at large. And so things that we found in our work, investments in, are things that you would not even necessarily connect with gun violence prevention, but are very much examples of gun violence prevention. Investments in green space, ensuring access to affordable housing, improving street lighting, equitable access to early childhood education services, access to community-based programming that engages youth during their teenage years, so they're getting job and educational training, investments in public libraries. All of these things have connections to reductions in gun violence and other forms of crime. That is, none of this, right? Did anyone see the word gun control here? Or any sort of politics here? No, these are all things that would only improve the well-being and health and vitality of a community, and also would reduce the likelihood of gun violence in a community. So the first step in this context, and what we're trying to argue for, is saying those 11 million kids that were exposed to gun violence in their neighborhoods, let's reduce that. That's the first step, right, of saying we want kids to feel safe. Because some of the work that I've done, and with my colleagues, has shown that kids who report carrying a gun to school are only doing it because they feel unsafe. So let's make their neighborhood safer. So as a first step, that's part of what we do. Then we go to the school environment and we say, all right, let's remove some of these punitive disciplinary practices that just expel kids without actually attending to what's going on, right? Let's implement universal school-based violence prevention programs that really focus on pro-social skill development. They're shown to be very effective. Let's use restorative justice practices in lieu of punitive, as a form of conflict resolution, in lieu of these more punitive strategies. Decriminalizing a school environment and reshaping it to be more nurturing so children feel safe and challenged and supported, which is what they should feel, right? Schools, it's not enough for a school or a community to be a space that is free from violence. It has to be a space where children can thrive. So if we really attend to this, right, in our communities and our schools, this right here is such a critical part of how we could reduce this kind of violence. And then third, yes, access to firearms. Now, we have 400 million firearms in this country, so we have to figure out how do we coexist safely with them. That is a uniquely American problem. It is something that we have to figure out. Now, the good news is there is research by a number of just wonderful scholars that have shown very clearly that if we implement not just one of these, but all of these examples of policies together, this is really effective. And I'll give you some examples, right? So, banning large capacity magazines at the state and the federal level. Implementing something we call red flag laws, which is also known as an extreme risk law. So if someone's at high risk for causing harm to themselves or someone else, right, we can make it harder for them to get access to a firearm. Having a permit requirement to purchase a firearm. You need a driver's license to go buy a car. Well, yeah, you get a permit to go buy a firearm. Raising the age to 21 years old. The perpetrator yesterday in St. Louis was 20 years old, and that represents roughly 20% or so of active shootings are between the ages of 18 and 20, meaning if we just raise the age to 21, that in and of itself would be very effective. And then promoting the safe storage of firearms. So something like 70% of the firearms obtained that are then used in school shootings are obtained from that person's home. Okay, so let's store those guns safely. That means they should be stored locked and unloaded and separately from their ammunition. This isn't taking away firearms, right? This is just saying, let's live with them responsibly, right? Coexist with them responsibly. So this is a set of policies that if you wanted to, I don't know, maybe call your elected officials this weekend, say, hi, here are some things that I'd like to advocate for. These would be things that I would encourage you to do. We also at the same time want to make sure that we are really using school safety strategies that we know and school security strategies that we know actually work, okay? Behavioral threat assessment is a process. I don't know if any of you have known about it or maybe saw it implemented maybe in your high schools. It's implemented quite widely. This is an example of a process that's more in the realm of secondary prevention that says, okay, we know there's a potential threat, but instead of expelling a kid for behaving out of turn or what have you, or removing them away from their social circle and a school, which is often the primary source of support and care for a lot of kids, I recognize that there's a potential threat, and then let's meet them where they're at. Let's talk to them. Let's find out what's going on. I mean, that's essentially what behavioral threat assessment does, and it's been shown to be largely effective for all sorts of reasons. It's very well studied, but I would argue that a core tenet of behavioral threat assessment as a process is that it treats kids as human beings, right? It's understanding that many kids, as you saw earlier, have gone through all of these adverse childhood experiences. They're living through a pandemic. They may have lost a parent. Maybe they're exposed to gun violence. Maybe they don't perceive their environment to be safe. And instead of punishing them for that, which all of those are examples of systemic failures, instead of punishing that kid, it recognizes that that child is going through something that is often a product of our collective failures. And so behavioral threat assessment as a process can be very effective. And then I mentioned lockdown drills. You know, like I said, I really try to keep my mom hat off during these conversations. As a mom, to say, okay, my 6-year-old or 7-year-old is now sitting there and hiding behind a bookcase, and okay, I don't love it. I'm gonna be honest, but I have a couple of wonderful colleagues who have actively, rigorously studied the best practices for implementing lockdown drills thoughtfully and in ways that are in line with the National Association for School Psychologists and are done with care. So lockdown drills that are done with care and that follow a certain set of best practices can also be an example of how, not to prevent gun violence, but what I would call secondary prevention, right? They're to help prepare us to be responsive in that moment. And so those can be really effective. I know I'm short on time, so I'll just kind of finish up with this last thought right here, which is the last piece of the way we move forward is also then, of course, to say, if gun violence occurs in a school or in a community, what do we do in the aftermath? And that's where tertiary prevention comes in. The annoying thing is we spend all of our time thinking about this and not enough time thinking about the stuff that happens before. But here's where we want to think about, okay, mental health, early interventions and responding to PTSD, and also really committing to what we call trauma-informed schools. And so this is a lot of words on the slides, but I just wanted to essentially just to summarize here is that, yes, it's one thing to say mental health is important, but mental health is important not just in the aftermath of a school shooting, but like on a regular basis, right? And it's not enough to say that we will support kids the day after a shooting. They need consistent and equitable access to mental health. So that means we need to encourage our elected officials to support and invest in funds, right? And to say, here's how we're going to make sure that schools get connected to the local services that they need. And here's what we're going to do to implement this in practice. There's a lot of rhetoric around this, and even around, responding to PTSD, that is just rhetoric. And there's a way in which we can implement this in a way that's more effective. So lots of things we know that do work in terms of supporting kids in the immediacy after a shooting, but also in the long term. Okay. The last thing I will just say to end is that one of the main questions I've gotten when I've shared this work or these ideas is like, well, this sounds great, and also this sounds expensive. Okay, to which I would say, we have money, we just don't spend it in a way that is informed by the evidence. So I'll give you an example. Here in New York City, we spend about $400 million a year in our public school system on school safety, okay? 200 million of those dollars, over half the budget, goes to police and schools. There is no evidence that police do anything to increase the safety of schools, certainly not in schools that serve predominantly Black and brown children. But that's $200 million that could go towards any or many of the initiatives I listed right here. So when people do, I think the funding piece is important because a lot of what I've described sounds like, oh, that's a lot and that's expensive, or that would take a lot of willpower. But go back to the scope of the problem, right? This is a big problem. It warrants investment. But we have money we could use. We just could use it more thoughtfully, but also more equitably. So I will end there, and I will take questions. Thanks, and thank you.
Hi. You had mentioned specific ways to go about training kids for, I'm totally blanking on all the words, I'm so sorry.
No, don't apologize.
For like gun shootings, like training kids for that in schools. I know a lot of us were raised in one of the first generations to have to start going through that.
Mm-hmm.
What are some of those practices that might make it a little less impactful to go through that training for the kids?
That's a great question. So what are the best practices for lockdown drills? So my colleague, Dr. Jackie Schildkraut, who's at SUNY Oswego, and her colleague, Dr. Amanda Nickerson, who's at the University of Buffalo, they actually just wrote an entire book on lockdown drills, what we know, what we don't know, and the best ways to go about them. So I am going to give you the very brief overview, which is to say that first and foremost, there's no need, first of all, there needs to be time before and after, right, to process what's about to happen. It should be made very clear to all the students that this is a drill. So we often, I'm sure many of you have seen in the news, maybe you've experienced it yourself, the idea of reenacting a shooting or with, with fake blood or whatever. There's all sorts of ridiculous things that happen in school. None of that is necessary, and all of that can obviously contribute to increased anxiety and stress for kids. So the understanding that it's a drill, having the time before and after to process it, and then really framing it as, here are some critical steps. So students are walked through, this is why you lock the door under this circumstance, here's where you would go. It's really framed as what we would call an emergency preparedness effort, similar in some ways to how you might do a fire drill, right? When I was growing up, we did fire drill, we still do, which is framed really as a way to say, yes, this is one thing that could happen while you're in a school. It is a relatively rare incident. Here is how we would collectively be prepared as a school community to respond. A lot of it is just about framing and having discussion points, but thankfully there are people like Dr. Schildkraut, Dr. Nickerson, who are doing this work to explain to us what that looks like in practice. I don't know that right now about 95% of schools around the country implement some form of a lockdown or active shooter drill, usually about 4 times a year. At this point, it's mandated by many states to do that, but many of these schools are doing so in ways that are not looking at the best practices. It's unclear if schools are even being shown what the best practice looks like. There's also some argument to be made, I would just add to this, which is to say, school teachers and staff may need to be trained in a way that's different than, let's say, the second graders, right? So maybe there's a way in which we could consider the developmental differences in that wide range as we think about how to prepare a school community more broadly for this kind of incident. Yeah. I mean, I'm okay if you shout it out, but.
Hi.
Hi.
So realistically, how do you feel how quickly like a plan that you presented could be implemented? Because obviously we understand that there's kind of a rush to get something like this put into place because we really do need to find a solution to this problem, but not to get into like politics or anything like that, but that obviously has a huge influence on how quickly things like this are put into place, and I'm just curious as to how you think, how long it would take for that to happen.
So I think everything, if we put the pieces of legislation I had on that one slide aside just for a moment, although I'll come back to that in a second, all of these other components that I shared, investments in like place-based interventions in communities and rethinking how we handle, like I said, disciplinary, like I'll give you an example, right? Right now under the Elementary and Secondary School Act, if a student brings a gun to school, okay, doesn't use it, isn't necessarily even bringing it with the intent of harming someone else, just brings it to school, maybe because they feel unsafe, which a lot of our research has shown is often the motivation, they have to be expelled under this law for at least 1 year, expelled for at least 1 year. Now, that's a policy that doesn't actually ask that kid, well, why did you bring that gun to school? And what's going on? And what can we do collectively to attend to that? So that kind of policy, just removing that policy and then saying, nope, we're going to replace that with a behavioral threat assessment process, right? We're going to really retool how we attend to, disruptions in the classroom. There's the non-legislative pieces here, and those kinds of education policies could be reshaped and implemented, frankly, right away, right? There's not, in theory, if we could say this isn't part of our initiative, right? And it's not political. Who doesn't want greener neighborhoods or street lighting that makes it safer for us to walk at night and, what have you? Or what parent wouldn't love to have access to affordable early childhood services, right? I mean, these are all things that would improve the lives of so many people in so many communities and have such a profound impact. And a lot of this has been shown, right, in different pockets of the country to be very effective already. But if we said, okay, let's lead on this, right? If we looked to our federal government and said, lead on this with these things in and of itself would be remarkably effective. Yes, the legislative piece is harder, but I would argue that some of the things up there, like promoting safe storage, my in-laws, I have family members who are gun owners, and safe, responsible gun storage is a part and parcel of owning a firearm, and I think most responsible gun owners would agree. In fact, there is data that show most responsible gun owners absolutely agree that safe storage is a responsible, reasonable thing to implement. Raising the age to 21, having a permit. These are things that seem fairly reasonable to add to and to put in place and to say, again, we are not removing firearms, we're just making that coexisting safely. So a lot of it has to do, I think, with how we frame this. My general perspective is to say, and part of why we even think about gun violence as an ACE, and I think it's really important we talk about it as such, is to highlight that gun violence, again, is not a political issue. It is a child health issue, right? It is a learning issue. We keep hearing about these terms. Everyone's rightfully very concerned about children's learning and test scores during the pandemic, and that is certainly something we need to think about. How do we support children in their education? Well, but we got to address this first. The kids aren't going to learn if they're being exposed to this level of violence, or they go to school anticipating this kind of violence. Who's going to focus? Who's going to take a test, right? So that's why I said at the very beginning, why do I think about the intersection of these issues? It's because they're so interrelated. So if we start framing this is an educational issue, this is a children's health issue, and this is a community health issue, right? And less so about this is a red or a blue issue. to me, that's where I can see some movement. I think there are many others, and not myself, who have done a really wonderful job in their respective spaces of trying to frame this issue in that way. But yeah, legislatively, it gets held up, and that part is hard. But I think a lot of what I presented here could be implemented sooner than later. I don't see any reason, I can't think of a reason why anyone would disagree with it fundamentally. You know, I've been wrong before. Yes. There's a question. Well, first of all, graduate and bring your passion and excitement and energy into all of these spaces, whether it's via a nonprofit or a local organization who's doing this, violence interruption work, or in graduate school where you're doing the research and the science behind this. I mean, I think the biggest thing we want, right, in this space is the energy and enthusiasm to do it, right? That's really what we need, and there is that strength in numbers. I forget who said it, like, you are among the generation who has grown up with this as your backdrop, and that is so heartbreaking and also so unnecessary, right? That has been part and parcel of your childhood experience, and that energy, we've seen this with March for Your Lives, post-Parkland, really a movement of young people in saying, no, this is not okay. I am not okay with this being my normal. I do think there's a number of wonderful organizations, like Every Time for Gun Safety, I'll just give an example. They have a student-led chapter, right? And a lot of my students have been involved from a volunteer and organizing capacity. You know, that works. So to your question of how do we move these things forward, that kind of stuff matters, right? The phone banking and the volunteering and the organizing around these different issues so that energy isn't lost, so that our elected officials who might seem removed from the day-to-day impact of this, right? Who may not be experiencing ACEs in the way that our generation collectively have. They need to know that this is not something we're okay with normalizing. I think that the normalizing of this kind of violence is something that I feel like we collectively can disrupt in different ways. Sorry, that was a little vague maybe, but that's where I'm thinking right now. Yeah, of course.
Hi.
Hi.
I just have a quick question. So, my question here is, how often are people killed by their own guns?
Say that last part again.
How often are people killed by their own guns?
By their own?
Guns.
Like accidentally, you mean?
Yeah. Yes.
I think accidental deaths comprise something like 4 or 5% of all firearm-related injuries and deaths. So it's a small proportion, and most of those are often children, right? Little kids who find a loaded gun in their home. But there is plenty of research that shows that the increased presence of firearms leads to more firearm violence. To quote a colleague of mine, you can't have gun violence without a gun. So, you know, it's why we have to take collectively the responsibility of owning firearms so seriously, the way we would for anything else, right? A car or anything like that. And in doing so, can ensure that our homes and by extension our schools and communities are safer. Okay. Thank you. You guys were great. Thank you.
I just want to thank everyone so much for coming. Thanks for your great questions. And I want to thank Dr. Sonali Rajan one last time for coming to talk with us. For those of you that want to have the opportunity to chat with Dr. Rajan, we're going to be heading over to the bridge. And there's food, just saying.